Ballad Bedside Bytes, Troubleshooting Chest Tubes, the Boat Check.
Hi, my name is Wayne. I'm a trauma and critical care coordinator at Johnson City Medical Center, and today we'll be going over some chest tube troubleshooting. One habit every nurse should develop is every time you walk into the room of a patient with a chest tube is to perform a quick boat check. It takes less than 10 seconds, and it can help you recognize problems before your patient starts to decline. Before your first boat check, ensure you establish a patient's baseline by receiving a thorough handoff from the offgoing nurse and inspecting the collection device during bedside shift report. Verify the physician's orders and ensure the collection device settings reflect those orders. Complete a thorough respiratory assessment as part of your head-to-toe assessment, ensuring that you inspect and palpate for crepitus. From then on, every time you enter the patient's room, compare what you see to the patient's baseline. Think of the boat check as your 10-second visual safety scan. Every room entry, every patient with a chest tube, every time. Now we'll go over a boat assessment. B is for breathing and bellows. Has there been a change in your patient's work of breathing? And if there's an order for suction, is the bellow fully expanded? O is for output. Has the drainage changed? Is there more, less, or a different color? A is for air leak. Is there a new air leak or has an existing one disappeared? T is for titling. During your boat check, assess to see if there's a change from your baseline. Remember, during your boat check, you are simply answering the question, has anything changed since the last time I checked? If you identify a change during the boat check, start by assessing your patient's respiratory status, then work your way through the chest tube system. We'll start at the insertion site and remove the chest tube dressing to assess for any displacement or obstructions. Remember to palpate the area for any changes in crepitus. Next, we're going to follow the tubing, looking for any kind of loose connections, kinks, or occlusions, dependent loops, or breaks in the closed drainage system. Last, we're going to confirm that the drainage system is below the level of the chest and will reposition your patient if appropriate. Here's some quick troubleshooting. Has the patient's breathing changed? Check for a blocked tube or break in the drainage system. Has the output suddenly stopped? Look for obstructions and reposition the patient. New air leak? Check the connections for a loose or broken seal. And if there's titling changes, assess the patient, then evaluate the tube patency and position. If you've identified a change in your patient's boat check that you can't correct through troubleshooting, here are some instances where you may want to call a provider. New or persistent air leak that hasn't resolved, bright red blood or sudden large volume of ongoing output, displacement of the chest tube, or worsening respiratory status. If there's a sudden rapid decline, activate a rapid response. The boat check isn't just another assessment, it's a habit. Every room entry, every patient with a chest tube, every time. Know your baseline, look for changes. If something changes, assess your patient first, then work through the drainage system. A boat check takes less than 10 seconds, but it can help you identify a problem before it becomes an emergency.